DeFazio for 5 minutes.
Well, yesterday, Paul Ryan of Wisconsin, the Republican chair of the Budget Committee, revealed his projected future for seniors in America and their health insurance coverage. It's very interesting. What he says is, starting with people who are age 55 and younger, there would be no traditional Medicare. That's a pretty radical departure. But he says, don't worry, what we will do, what in the Republican vision we will do, is the government will take money and it will give it to private health insurance companies. Seniors would be forced to go to those private health insurance companies and buy a policy from them, and it would be offset by the amount of money that the federal government gave to the private health insurance industry, and market discipline would prevail in the Paul Ryan view of the world. Isn't that a wonderful thing? Well, guess what? We got that today. We have an unregulated health insurance industry in this country, exempt from antitrust law, unlike any other business in America. And over the last 10 years, premiums for people who buy health insurance have doubled in my state, pretty much the same all around the country. Some places more than doubled, other places a little bit less. But that's over 10 years. But in Paul Ryan's view of the world, that's a success. Why is it a success? Well, because insurance company profits are up very dramatically. So what if people are paying twice as much for their policies and they have more and more exclusions every year? There's not a little problem with his proposal, other than the fact that this is not a competitive industry. They are allowed to collude, redline people. They are allowed to get together and collude and drive up prices. They are allowed to get together and collude and decide which states they will go into or get out of to help their sister and brother companies make more profits. He would do nothing about that. That system would continue. Then there's the little problem of he would repeal so-called Obamacare. Well, one of the things I think most Americans liked about that legislation was it prohibits insurance companies from refusing to sell you a policy because you were sick once. That's called pre-existing condition. It also prohibits insurance companies from taking away your policy the day you get sick, something called a rescission. In Paul Ryan's world, those things are back. Pre-existing condition exclusions. Guess what? Aging is a pre-existing condition. Go out today, if you're 55 years old and you've been sick once in your life, and try and buy, at any reasonable price, a private health insurance policy. In Paul Ryan's world, market discipline will take care of that. No. What he's doing is a massive shifting of costs onto seniors. The kind of thing that drove seniors into bankruptcy back in the 50s and 60s and had their poverty rate at 20%. That's why we adopted Medicare in this country. So seniors wouldn't be driven out of their homes and into bankruptcy in their later years when most people require more health care. In Paul Ryan's world, the heck with that. In fact, the Congressional Budget Office, which some days he likes when they give him answers he likes, and some days he doesn't like when they give him answers he doesn't like, but it's an impartial group, bipartisan group, and at this point controlled by the Republicans, has said that under Paul Ryan's world, seniors, instead of paying 25% of the cost of their health care, which they do today, and they would in the future if we continued Medicare, will pay 68% of the costs of their health care. Now, how many people, how many seniors in this country, other than the people he pals around with on Wall Street and at the country club, but other than them, how many people can afford to pay 68% of their health care costs? What middle-class American can afford that in retirement, no matter how prudent they've been their whole life, no matter how much money they've saved their whole life? Very, very, very few. So we have here a plan to enrich the private health insurance industry, allow them to return to all their bad old ways, rescissions, pre-existing exclusions, and all that, so that the government can give them money. And he says this will save the government a lot of money. Well, it might, but it's going to kill a lot of seniors or drive them into bankruptcy, just like the days before we had Medicare. If one looks at the other Republican creation of the last decade, Medicare Part D, you know that thing, seniors with their pharmaceutical costs with the drug prescription. That wasn't done through Medicare. It was done through the private insurance industry. It cost $750 billion, $650 billion, $650,000 million over 10 years. Borrowed money.
The gentleman's
That's Paul
time has
Ryan's role.
expired.
Give all the money to the insurance companies. Good work, Paul.